The CDC has signed off on a second booster shot for people over 50 who are at least 4 months past their first booster. This comes as the CDC says the Omicron subvariant BA.2 is now the dominant variant here in the U.S. Within the last week, 10 states have reported upticks in reported COVID-19 cases, including Alabama and Florida. Dr. Patel joins us now for more on this. All right, Doc, so people ages 50 and up can now get their second booster shot. So what does this mean for our fight against COVID as this subvariant of Omicron spreads across the nation?
Kira, I think it's a great step forward on the individual level, just kind of like what you just mentioned for those people who are 50 and above or have underlying medical conditions, but maybe not necessarily going to make a huge impact on the population scale. Because as we think about the potential of a next surge, we want to do what we can to protect those who are high risk. But we have to remind ourselves that less than a third of our entire population has gotten the third shot, the first booster, and we still only have about 60 to 70% of people who are fully vaccinated with the primary series. So this is more of an individual protection that we're looking to, great option for those who need it, but not necessarily going to make some long-lasting, huge change against the global fight against BA.2.
So earlier today, President Biden gave remarks, as you know, on vaccine supply and COVID-19 funding. Let's take a listen.
We have enough supply to give booster shots to those newly eligible individuals. But if Congress fails to act, we won't have the supply we need this fall to ensure the shots are available free, easily accessible for all Americans. Even worse, if we need a different vaccine for the future to combat a new variant, we're not going to have enough money to purchase it. We cannot allow that to happen. Congress, we need to secure additional supply now.
Let's talk about what he said and what's your take on the position that we would be in if we lost COVID-19 funding. He talked about the need for more money, more resources, and that indeed that's exactly what he's going to do until we have a better grip on this.
I could see in President Biden's face what he was saying. I could feel it. And there is a great concern that without this extra money, we are going to not have the funding for everything from monoclonal antibodies, specific treatments for those who are immunocompromised, to ways to target the next variant with the vaccine, to even things like Paxlovid, which we're really relying on. So there's a lot of funding cuts that may actually impact our ability to protect those who are high risk come this upcoming summer. And I will also give President Biden a shout out for going out there and getting his second shot live to make a good demonstration at 79 years old. He is in that population who should be getting one.
That is true. Well, he also, as you said, received his second booster shot in front of the entire nation. And so what do you think that just tells us about the vaccination rate? Because earlier in the pandemic, 2 years ago, herd immunity was a pretty hot topic. So are we there yet?
Kira, herd immunity is this moving target that we keep redefining. We don't know how exactly to hit it. It's possible we may not actually get to the pre-definition of herd immunity. We once said it was 60 to 70% vaccinated. But the problem is that people out there who have gotten natural immunity can still catch COVID. Those who have gotten vaccinated can still as well. So it's important that we focus on preventing the people and not just aiming for this arbitrary goal of herd immunity.
All right, finally, the president, although we weren't able to hear it, did start talking about this new onestopcovidgov website. Why now? And also, what took them so long?
I wish I knew what took them so long, because this domain is easy to remember. It's a good one-stop shop, as you mentioned, for people to get all their information. What we heard from the White House is that the reason it's coming now is because now we have the tools. Regardless, as my esteemed colleague, Dr. John Brownstein, was mentioning, I like the fact that there's aggregate data. You can go on right now and you can look up your zip code and look at that test to treat option, find where Paxlovid is available for you as one example of what to do. I hope people rely on this website, especially those who are high risk, those who want to plan for what may potentially happen. Now is not the time to get complacent.
And I noticed also, too, clearly, because of your daughter, you've got your Easter bunny very carefully placed over your right shoulder. Is the bunny going to get a shot?
Oh, Kira, I actually didn't even know that bunny was there until a few seconds ago, but that's okay. This can be the mascot. His name is now Booster Bunny, and he's here just to represent public health and all the pastel eggs that are coming in about a month.
You are so quick on your feet. That's what no pun intended. Thank you so much, Dr. Patel and Booster Bunny, who we will pay close attention to on his or her health. And a programming note, you can also watch the special edition of 2020 tonight, 24 months that changed the world, looking at the state of our nation 2 years into the pandemic, because our Dr. Patel is in that special tonight, 10 p.m. Eastern on ABC, and then tomorrow on Hulu.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.